Public Health Agency of Canada, which has been known to disregard privacy concerns in the past, is now looking to hire someone to track and trace your private medical information and your records through the newly introduced electronic medical record systems at primary care physician offices. Tamara Ugolini here with Rebel News, and in recent weeks, the Government of Canada has put out a call to hire somebody to track and trace the medical records of all Canadians. In a publication put out on March the 6th, Health Canada put out a call for a supplier to help what they call strengthen public health surveillance through primary care insights. The description reads: the adoption of electronic medical record EMR systems in Canadian primary care settings is widespread, and their potential benefits for disease surveillance are well acknowledged. Pan-Canadian primary care EMR data is recognized as valuable for federal public health surveillance programs. The recently released Pan-Canadian Health Data Strategy emphasizes the importance of primary care research moving towards real-time data sharing and person-centric data. But what exactly is the Pan-Canadian Health Data Strategy? Well, it was born out of the COVID-19 pandemic naturally, and according to the Public Health Agency of Canada, which runs and delivers this strategy, COVID-19 has highlighted issues that make it a challenge to collect, share, and use health data for the benefit of Canadians. Health data includes public health, health systems, and population health data. The strategy is run by an expert advisory group and is chaired by Dr. Vivek Goel in combination with 17 members. The latest Health Data Strategy 2022 report shares that the inability to integrate data in real time across hospitals, primary care, testing, vaccination, and genomics, among others, impair insights to measure the efficacy of vaccines, track the emergence of variants of concern, and mount efforts to address health inequalities. The strategy began with the Safe Restart Agreement in the fall of 2020 that dedicated more than $19 billion federal funds to help provinces and territories safely restart their economies and make our country more resilient to possible future surges in cases of COVID-19. It began with the COVID-19 Health Data and Evidence Virtual Library, whose short-term data priorities included critical data on hospitalizations, case counts, and testing, and there it is, vaccines, safety, coverage, and effectiveness. Now, the Public Health Agency of Canada's recent supplier offering says that it needs access to timely and high-quality primary care EMR data covering all Canadian provinces and territories in a secured environment. This access should also include supporting documentation, training, and analytical work services. And now, the agency is expanding its capacity to include risk assessment and trend analysis in priority areas such as long COVID, antimicrobial resistance, that's AMR, and mental health. This involves the use of innovative, validated tools and expertise from primary care researchers and practice-based research networks. PHAC expects to engage with contractor and their team seeking access, support, advice, and intelligence derived from the contractor's tools or platforms as outlined in the Statement of Work. The contract's primary objectives involve granting the Public Health Agency of Canada access to primary care electronic medical record data in a, once again, secure environment. This access requires regulatory documentation, including research ethics board approvals and training certificates. PHAC aims for comprehensive access, including system documentation, data dictionaries, user support, and the ability to communicate with providers. Additionally, the contract involves developing new extraction tools to include full charts and clinical encounter notes. I reached out to the contact listed on the page and I asked the following. Firstly, has the general public been informed and or consulted to determine whether or not they want their primary care data solicited by the federal government and PHAC? Secondly, how and for how long will this data be used and stored? And lastly, will Canadians have the option to opt in or opt out? And if so, how? Now, at the time of this report, the contact did not respond to this inquiry. Will the Pan-Canadian Electronic Medical Records System just become another tool of the Public Health Agency of Canada to infringe on travel rights, ostracize individuals from society, and utilize general coercion tactics to gain vaccine uptake compliance based on your vaccination status, as they did throughout the COVID-19 hysteria during vaccine passports. After all, according to the government's own website, in certain provinces and territories during this medical apartheid system, sometimes vaccine passports were simply referred to as the Pan-Canadian. Is it a more broad offshoot of other health data usages like the Ontario-specific Panorama system? It's described as an electronic management system that supports the vision of a provincial immunization system where individuals, healthcare providers, and public health all have secure, real-time access to the same immunization information. In light of all of these developments, concerns around rights, privacy, segregation, bodily autonomy, and informed consent continue, especially as this is the same agency that continually disregards privacy at the helm of public health necromancer Theresa that sought to monitor the online activity of the vaccine hesitant and hired the private company Blue Dot to track and monitor Canadians' personal cell phone data to ensure that they complied with COVID-related public health measures after they bought that data from TELUS. For Rebel News, I'm Tamara Ugolini. If you think that the COVID-19 vaccines should be pulled from the market, then you can send Health Minister Mark Holland an email and sign our petition at nomoreshots.ca to find the most current and evidence-based information relating to these novel products. Please visit that website, nomoreshots.ca.